Okay, I'm going to touch on a few basic facts about sex, all of which I'll expand on in upcoming webcasts, but which I feel merit some quick attention. We'll start with the bad stuff. The United States has the highest teen pregnancy rate in the industrialized world. The Center for Disease Control says that 1/3 of girls get pregnant before the age of 20. Teenpregnancy.org states that there are, quote, 750,000 teen pregnancies annually. 8 in 10 of these pregnancies are unintended, and 81%, so about the same 8 in 10, are to unmarried teens. A New York Times article from January of this year, 2010, says, teenage birth and abortion rates also declined during this period, between 1991 and 2005, with births dropping 35% from 1991 to 2005 and teenage abortion rates declining 56%. In 2005, though, annual pregnancy rates started to rise again. From the same New York Times article, quote, some experts speculate that the rise in teenage pregnancy might be partly attributable to the $150 million a year of federal financing for sex education that emphasized abstinence until marriage, avoiding all mention of the possible benefits of contraception. This began in the Clinton administration and was bolstered by the Bush administration. At this point, we pretty much know that abstinence-only education is basically a crock of shit. It doesn't work, and we're starting to see that a little bit. There are countless ways to prevent pregnancy, though almost all of them are incumbent on some medical commitment from the woman. The pill, the patch, Depo-Provera, and Norplant are some of the more popular and common hormonal contraceptives. Condoms are naturally the most widely available and common barrier method. They are also the most common product used for the prevention of pregnancy. However, despite the touted success rate of 97 to 98%, quote, the typical use pregnancy rate among condom users varies depending on the population being studied, ranging from 10 to 18% per year. Basically what that means is 10 to 18% of the time they don't work. Now that takes into account actual usage of condoms, as in the way people are actually using them. It includes people who use old condoms, who use ill-fitting condoms, and people who just don't know how to put them on. We'll cover how to put on a condom at a later time. Condoms aren't just popular because they can prevent pregnancy, though. Hormonal contraceptives do precisely nothing to prevent sexually transmitted infection. So the best protection sexually active people have against the tons of scary and dangerous STIs running around the country is going to be the condom. I'll devote a blog post to STIs at a later time, but right now I just want to touch on 3 to give you kind of an idea of what to look out for. The first one, not because it's the most prevalent, but because it is one of the most insidious, is HIV and AIDS. The CDC estimates that over 1 million people in the United States are living with HIV. 1 in 5 of those, or 21%, is actually unaware that they are infected. A common misconception is that most HIV and AIDS sufferers are gay males. According to the CDC, 53% of new HIV cases are from men having sex with men. 31% of annual infections are from heterosexual sex, and 12% are from intravenous drug users sharing needles with an infected person. Women count for more than 1/4 of new infections each year. This is not, as some might have us believe, a gay disease, though it does affect the gay community as a whole more substantially than it does heterosexuals. Herpes is another one we hear a lot about because it is one of the most prevalent STIs. In the U.S., 16.2%, or about 1 in 6 people between the ages of 14 and 49, have genital HSV2 infection. That number has stayed about the same. Over the past decade, the percentage of Americans infected with genital herpes has remained stable. Genital HSV2 infection is more common in women than in men. Check out this site for some great information on herpes. Last one for now will be chlamydia. Chlamydia is the most frequently reported bacterial sexually transmitted infection in the United States. In 2008, over 1.2 million chlamydial infections were reported to the CDC, and over 2 million people are estimated to be infected. A majority of infected people will never show symptoms, but in about 10 to 15% of cases, it can lead to severe problems in women that can include permanent damage to the upper genital tract, which can lead to infertility and potentially fatal ectopic pregnancy, which is basically a pregnancy that happens anywhere outside the uterus. It can also increase your chance of becoming infected with HIV if you're exposed. I could honestly go on all day about all the scary and dangerous STIs out there, and I will cover more in greater detail later on, but it is not only possible, but relatively easy to be protected and prepared. I encourage everyone to do some research on your own. The CDC is a fantastic resource, one that I've drawn from liberally here, as you can tell, and their information is actually fairly easy to digest. Go do 20 minutes of reading and buy some condoms. Okay, with that nastiness out of the way, let's get to the good stuff. Contrary to popular belief, sex should last no more than about 7 to 10 minutes. No less than 3, generally no more than 18. This doesn't include foreplay, which can last as long as you have time for. As long as you're not blowing your load after a minute or two and you're making sure to take care of her needs, chances are pretty good you won't have any complaints. Most women can't orgasm without direct clitoral stimulation. However, most women are still sexually aroused after orgasm, so we appreciate intercourse afterwards, unlike most men who are tapped out after orgasm. So, play with her clit, gentlemen, and follow her direction. And don't feel like you aren't performing well if she can't come just because you're having sex with her. Most women can't. It's not a comment on your performance. Speaking of performance, lots of men can't come from oral sex. Bet you didn't know that. But even for those who can, it actually takes them longer to get most of them off via blowjob, but it is a perfectly acceptable alternative to anal or vaginal sex, provided your jaw can hold out. Getting good at blowjobs takes practice. Girls, I guarantee you will not have much trouble convincing a guy to be your practice dummy. Guys, please don't be afraid to give direction, and ladies, follow that direction. Oral sex comes with the very happy side effect of having no danger of pregnancy and a much lower rate of STI infection. Handjobs are even better at preventing STIs, given that they have virtually no chance whatsoever of transmission and pregnancy is not an issue there. Masturbation is something that we perfect early, usually well before we bring a partner into the bedroom, and there are studies that have suggested that masturbation starts as early as the womb, so we have a lot of practice playing with our favorite toys. Having someone else try to accomplish what we have spent years perfecting on our own is somewhat implausible. Consequently, in general, women suck at handjobs, and for most guys, the clit is pretty hard to finesse. Don't feel bad if you can't manage to duplicate your partner's handiwork. Oral sex is generally preferable to both genders, but don't be afraid to direct your partner and teach them how to do it better. Watch each other masturbate, take mental notes, ask questions, and practice. And again, it should not be a problem on the practice front. The common theme you may have noticed here is communication, and that starts with talking. It can be hard to voice your desires, because it can be a very vulnerable conversation, and it can open you up to having somebody reject you. And especially for women, most of us have been taught that good girls don't talk dirty, and even somewhat clinical discussions of what feels good where make a lot of women uncomfortable. But learn to talk to your partners. Tell them what's good, what you want, what you don't want, and then explore why, so they're better able to adjust to your needs. Conversely, listen. Be open and accepting. Don't just hear the words, actually understand what it is your partner is telling you. Good communication is half saying what you mean, and half actively listening to what is being said. If she says, rub it this way, then do that. And if he says, lick it like that, then do that. Communication goes beyond how to rub my clit or suck my dick better, though. It goes to the deeper sexual desires. Almost everyone has something that gets them off in the bedroom that isn't quote-unquote normal. It may be spanking, or light bondage, or gags, or bright lights, or nylons, or standing up, or really any number of virtually limitless options on how to enjoy sex. Talk to your partners about what you want in the bedroom. And even if you are in no way interested in what your partner has suggested, don't freak out or belittle them. If your partner tells you and opens up to you and says that he or she wants to try water sports, for example, and you're pretty turned off by the idea, don't just shout, "Oh my God, that's gross!" Just say something to the effect of, "Honey, I really can't honestly see how that would be enjoyable for me." This allows for an actual conversation to take place. And if what you want in the bedroom, or the kitchen, or the bathtub, or the roof can't or won't be met by your partner, you now know that you're not perfectly sexually compatible and can make decisions accordingly. But, as the guru Dan Savage says, be good, giving, and game. There are some relatively harmless things that people want to try to include in their bedroom repertoire. And even if you can't see how it might be enjoyable for you, go ahead and give it a try. Maybe you can use that opportunity to present something that you want to do, and you can make that a little give and take. I'll talk about fetishes and kinky play in more detail at a later time to help figure out what options you might have. Okay, quick recap. There are some bad things that can happen as a result of sex, but you can approach it intelligently. Be informed. I've linked a bunch of great resources, and I encourage you all to take a few minutes to read through them. Be prepared. Buy some condoms, men and women both, and keep them handy. Guys, do not carry a condom in your wallet. And be willing. Willing to say yes, willing to say no, and willing to work on improving your skills. See you next time, guys. Good luck, and have fun.